Hi guys, welcome back to my channel. Today we have the special topic that we will talk about CELBAN exam, and here we are with Shabnam.
Hi everyone.
Yeah, she is my speaking partner, and she has lots of experience about the CELBAN exam. So Shabnam, can you tell me a little bit about the CELBAN?
Okay, CELBAN is exactly like IELTS exam, and you have writing, reading, listening, and speaking, and they're gonna review your English proficiency. But for CELBAN exam, it's really good that it's a health-related topic. So for nurses, it's a better exam, because for IELTS is a general topic in reading, writing, and listening, or even speaking. So CELBAN exam, that would be a better idea for nurses, because you're familiar with the situation, or you can think about better to answer the question, or write about something, or read about something. And yeah, that's it.
Yeah, so what the score do we need to achieve the requirement?
Yeah, for listening, it should be 10 out of 10. For speaking, it should be 8 out of 10. Reading, 8 out of 10. And for writing, 7 out of 10.
Oh, it's pretty high score.
Yes, for listening part is a little bit challenging. Yeah.
Yeah, okay. So but today we will talk about the speaking part only. We will not talk about the other part. So what the speaking part look like in the CELBAN?
Okay, in speaking, you have 3 role plays, and your speaking that would be with Zoom, and it's around 30 or 35 minutes, and you have examiner, and it's totally online. And for first one, they're gonna ask a warm-up question, that what's your name, where are you from, and how long have you been in Canada, or something like that. There is no point for this question, because it's warm-up question. And maybe for the first question, they're gonna ask about to describe something. For example, describe your first day at school, describe your university, describe your first day at workplace. It's you have to describe something, you have to use right adjective, and yeah, that's it.
Show about your language.
Yes, exactly. It's not your medical knowledge.
Oh, yeah.
You have to just speak correctly by grammar, or use right vocabulary, right adjectives. And
right.
after this question, which is describe something, they're gonna start role plays. You have 3 role plays in your speaking. Role play number 1 is related to taking history from the patient, and I'm gonna tell about the taking history after that. And role play number 2 is about discharge instruction. And role play number 3 is about talk with your colleague and advice to your colleague. And after these role plays, you have 2 or 3 more questions, which is related to your opinion question, or
like
compare
or disagree.
Yeah, compare or contrast, or yeah, express your opinion.
It's kind of look like IELTS.
Yes,
some part
exactly.
of it.
Yeah, exactly. Yeah.
Okay, so today we gonna talk about the role play number 1, which is Shabnam just mentioned before, about their taking their patient history.
Yeah.
Okay, are you ready for that?
Yes, I'm ready.
Okay, so I will be a patient. Okay, and Shabnam will be registered nurse, because she did it very well on that. Okay.
Okay. We're gonna start. Hi, good afternoon. How are you today?
Oh, I'm pretty good.
Okay, my name is Shabnam, and I'm gonna be your registered nurse today. I'm going to taking down some details before you are visited by the doctor, and I'd like to ask a few questions, if it's all right with you.
Okay.
Okay. All the conversation would be confidential between me and you, and I'll just share them with your healthcare provider. Is that okay?
That's good.
Okay. Before we start, may I check your identity bracelet, please?
Okay. Here you are.
Okay, thank you. Can you tell me your first and last name?
My first name Natamon
Mhm.
and my last name Panmali.
Okay, can you spell your last name for me, please?
Panmale.
Okay, thank you. How would you like to be called?
Nat.
Nat, okay. And can I have your date of birth as well?
My date of birth 4th February
Mm-hmm.
1989.
Okay, and what's your occupation?
I am a nurse.
Oh, that's great. Okay, Nat, tell me why are you here today and what seems to your problem?
I have been cough for almost 3 weeks.
Mm-hmm.
Yeah.
Okay, just coughing.
Sorry.
Oh, it's okay. Any other concerns? Any other symptoms? Just coughing?
It's a little bit headache as well.
Headache. Okay. Do you know any possible trigger for your cough or your headache? Do you have any? Do you have experienced this before, or it's your first time?
It's my first time
First
actually.
time.
Yeah, for the permanent cough about 3 weeks. The trigger, I think it might be the weather.
Mm-hmm.
That
Okay.
pretty cold right now, but it quite affect my life, daily life. Like I could not sleep well because
Okay.
the cough. I cough whole night, something like that.
Okay. And are you experience any like common cold during this week? I
Oh.
mean, do you have any other symptoms like runny nose, runny eyes, or
I think
sore
about
throat?
2 weeks ago, I had running nose.
Mhm.
Yeah, and after that start with cough.
Okay. So your cough is started 2 weeks ago, right?
That's right.
Okay. And you mentioned that you have headache. Can you show me the exact location of your pain?
It's not located any part of the head. It's just like around the head.
Okay.
It's my head, not too much, but it's like a bother me sometimes.
Do you have any sinus problem?
No.
No. Okay. And can you describe your character of pain? I mean, is it dull pain in your head, sharp pain?
It's not sharp. It's not really dull. It's like a just general like pain inside my head, like a whole part of my head.
I see.
Yeah, it's difficult to explain that, but I feel like not comfortable with it.
Okay, on a scale 0 to 10, which is 0 is it means no pain, and 10 is the worst pain that you can imagine, how would you rate your pain?
About 5.
5 out of 10. Okay. Is there any possible things that can intensify your symptoms or worsen your symptoms in any way? Like cold weather, like
Yeah, just cold weather and sometimes lack of sleep.
lack of sleep. Okay. Or is there anything else that can relieve your pain?
Just Tylenol.
Tylenol. Okay.
Yeah, I took the Tylenol 500 milligrams for 2 tablets.
Okay. When was the last time that you took the Tylenol?
Last night.
Last night. And was it effective? It works?
Yeah, it works for a while, but after that, yeah, it restart pain again.
Okay. And is there any concern about your coughing or headache that would you like to mention?
Just permanent cough.
Permanent cough. Okay. Do you have any sputum? Is your cough productive or just dry cough? Okay.
No.
You didn't experience any sputum, right?
No.
Okay, that's fine. I'm going to ask some question about your past medical history. Is that all right?
All right.
Okay. Do you have any condition like heart disease, diabetes, hypertension, depression, or anything specific would you like to mention?
No.
No.
I don't think
Okay. Have you ever had any surgeries?
No.
No. Okay, great. And I'm going to move on next part, which is related to your family health history. Do you have? Is there anyone in your family member who ever had diabetes, hypertension, or depression, TB, pneumonia, or something like that?
My mom.
Your mother.
Yeah, she had the hypertension. I think about 5 years. Yeah.
5 years. And how she controls the hypertension? Taking medication?
Yeah, taking medication. She usually take it as normal, but I don't know what the name of medication.
You don't
but
know.
she take
But
it
it
every
controlled.
day. Yeah,
right?
it's in control.
Okay,
yeah.
okay. And I'm going to ask some question about your medication history. Are you taking any prescription medication?
No.
No. Any other medication like supplements, vitamins?
Just vitamin C.
Vitamin C every
Yeah.
day?
Almost, but not every day.
Okay, okay. What about over-the-counter medication?
Just Tylenol.
Tylenol, okay. And I'm going to ask other question about your allergies. Do you have any allergies to drug?
No.
No. What about food?
No.
Food, no food allergy, no drug allergy. What about environmental allergy? You have environmental allergy?
Oh no, I
No.
don't.
Okay, that's
Sorry.
great. Okay, and is there anything else would you like to add?
No, just coffee.
Just coughing. Okay, and I gather all information which I needed, and I'm going to hand over to the doctor who will be here soon.
Okay.
And how I address your questions so far? Is there any other concerns? Are you comfortable right now?
Oh, I'm good. Thank you.
Okay, and thank you for your cooperation.
Welcome.
Yeah.
Okay, guys. So we just finished the first part of the speaking exam, which is role play number 1. So you will get the crew card right
Yes.
on the screen
Yes.
when you take the test, and the thing is you have to take all the information which what they need on that card.
Exactly, yeah.
Yeah.
Because on your screen for role play number 1 and role play number 2, you have something on your screen that you can see, and you can ask your question step by step. Sometimes maybe for right now, maybe I forgot to ask some question. It's totally natural. But on your exam, you have table on your screen. So you can manage your question, you can organize your question, and you can go step by step for your question. And for role play number 2, you have some tips to know how to make discharge instruction.
I think it's probably need the knowledge, a little bit knowledge about how you would like to instruct your client.
Yes.
Yeah, when you giving discharge instruction to your
Yeah.
client for the role play number 2.
Yeah, I
Yeah.
think for CELBAN exam for speaking, at the most important thing is your English proficiency.
Yeah.
But for speaking, you need to know how to make a good communication with your patient, because your examiner act like a patient, and you have to make a good rapport with your
Interaction. Yeah.
and your eye contact, even you nodding your head, even you repeat their concerns. It means you are pay attention to their problem. So it's a good communication skill. And also it doesn't mean that you have to medically accurate, but you have to use some terms and medical vocabulary, and to make your speaking well.
Yeah, you are expect to be right like a nurse when you're taking the patient history. That is the role of the role play and in the speaking part.
Yes.
Okay, so now I think we get lots of information about the CELBAN exam. So I think maybe next time we can have a chance to talk with Shabnam again about the role play number 2 or role play number 3. But today here, thank you,
No,
Shabnam.
you're welcome.
Yeah.
As Natamon mentioned, it's lots of information, and we
Yeah.
are gonna divide it to other parts. And yeah,
So
just
do you have
waiting
any tips to recommend about how to practice the speaking?
yes. One tip is practice with mirror or yeah.
She's
Seriously.
my only one resource for my speaking part.
Thank you. it's record yourself by your cell phone. It's really good tip because after when you take the video from yourself and you're gonna practice, you can compare your first video with the 10th video, and you can find yourself better, and you can practice on mirror by yourself and just practice and practice and practice every day.
Yeah, I
that
agree.
works for you.
I agree with you. Yeah, the last time I took the CELBAN exam as well, I thought that the practice is only one thing we can do, right? If you're not familiar with the test, not familiar with the questions, what it's gonna be look like, the only thing you can do is just practice. And I did it a lot on my take a photo. No, take a video as well.
And guys, don't be shy or embarrassed about your speaking. Even right now, I can speak very well. I know I have mistake. I do mistake, and I do apologize because of that. Maybe I had some mistakes in my conversation with Natamon. I'm sorry about that, but you
did very good.
We are not a native speaker. English is our second language, so it's really okay to make a mistake, but as much as you can, less in your exam.
Finally she passed their speaking exam. That's what the reward. What we work hard on that. Okay, so please don't forget to subscribe my channel and
subscribe her channel.
Nurse Daily, and we can get more information about the to be a nurse here in Canada for the next video. Okay, now we are going. Bye.
Thank you guys. Bye.